Well, my name is BJ Fancher. I'm a PA with a doctorate, and I provide care in family practice and in psychiatry. It's really important when people come to you with depression or anxiety to get it right. If you can use a GeneSight, it helps you, then you don't have to think about, well, if this doesn't work, I have to go to B, and if this one doesn't work, these are my favorites. But the more you do trial and error and don't get success, you actually increase their risk for treatment-resistant depression or anxiety. And anxiety is debilitating. That's why we intervene and treat, because if you have a panic attack or an anxiety attack, this is what lands people in the emergency room. And I have a lot of people who tell me, I went to the emergency room, I thought I was dying. And they get to the emergency room and they can't figure out what's going on. They do all their vitals, they do their lab work, they tell them, you're fine. You're just having a panic attack. And so we can intervene and treat, and it is treatable. I'm glad you didn't have a heart attack. I can't treat a heart attack. I can prevent one, but I can treat this. So when you pull all your tools together, you're much more successful. I'd love to do it on everybody that comes in the door, but sometimes it's the people who've tried things. Those are the ones you definitely want to get it on, because then you can actually show them on paper. So you can take this medicine, and that makes people feel better that you're not just throwing medicine at them. So pushing about 10 years ago, when GeneSight was becoming available, I found the results to be reliable and valid and a useful tool. It is a very easy test to run. It's just a swab. There's no other invasive. It's not a needle stick, but it should be part of the kind of like a normal arsenal, and that way you can avoid interactions or difficult side effects where they just can't process the medicine. The company has done such a wonderful job, and I have used other brands. I keep coming back to GeneSight, and I kind of stay with them 100% now, because it's so easy to read, and it's quick, concise, and it is reputable and validated information.